They put it head-to-head with ibuprofen, same inflammation markers, same patients, same 6 weeks. The kitchen ingredient didn't lose. And I remember reading that study for the first time thinking, why does nobody talk about this? You know what nobody warns you about getting older? It's not the big stuff. It's the quiet stuff. It's standing up from the couch and doing that little pause, that half second where your knees have to decide if they're going to cooperate today. It's skipping the morning walk. Not because you don't want to go, but because yesterday it just hurt too much to bother. It's watching your grandkids run across the yard and thinking, I used to do that. What happened? Here's what happened. And this part most people never get told. And inside your knee, there's a thin tissue lining called the synovial membrane. When it gets chronically inflamed, which happens gradually, silently, over years it starts producing excess fluid. That fluid builds pressure. That pressure creates the ache, the stiffness, that grinding sensation that follows you from the bedroom to the kitchen every single morning. It's not just getting old, it's inflammation. Targeted, specific, addressable inflammation. And in this next few minutes, I want to show you what peer-reviewed research actually says about one ingredient that may help dial that down. Something that's been sitting in your kitchen this whole time. Stay with me, because the last point, honestly, is the one most people completely sleep on, and it might be the most useful one of all. The ingredient is ginger. Now, I know, you've heard ginger is good for you 100 times, but that's not what we're talking about here. What researchers actually found goes way beyond the general headline. A study published in Arthritis and Rheumatism, peer-reviewed, rigorous, legitimate, showed that patients with knee osteoarthritis who applied ginger topically reported meaningfully less pain and stiffness after just 6 weeks. Again, listen, just 6 weeks. The reason comes down to 2 compounds, gingerols and shogales. These naturally occurring substances appear to interrupt specific inflammatory signaling pathways in the body, the same pathways that pharmaceutical anti-inflammatories target. Except ginger doesn't carry the same risk of stomach damage that long-term NSAID use often brings. And here's something I find genuinely fascinating. Japanese Kampo medicine, their traditional herbal system, centuries old, was prescribing ginger specifically for joint conditions long before Western labs ran a single trial on it. Sometimes the old knowledge just quietly turns out to be right. So, 3 ways to use it. All practical, all grounded in research, and all starting tonight if you want. The first one, warm ginger compress, directly on the knee before bed. Grate about 2 tablespoons of fresh ginger. Wrap it in something thin, a clean dish towel, a piece of muslin cloth. Dip it in warm water, give it a gentle squeeze, and rest it on your knee for 15 to 20 minutes. Here's why this works on 2 levels. The warmth increases local blood circulation, bringing more healing resources to the area. And research does confirm that ginger's active compounds absorb transdermally, meaning they get through the skin and reach the inflamed tissue underneath. A lot of people report that the nighttime ache, the one that wakes them up at 2 a.m., starts feeling different within 1 to 2 weeks of doing this consistently. Now, the second way, and this one surprises people. Ginger oil massage. 4 to 5 drops of pure ginger essential oil mixed into a tablespoon of coconut oil or olive oil. Massage it into the knee. Slow, circular motions for 5 to 10 minutes. Here's what's actually happening beneath your hands. That circular massage movement encourages lymphatic drainage. Your lymphatic system is essentially your body's waste clearance network. And around an inflamed joint, it often gets sluggish. The massage physically helps move that backed up inflammatory fluid out of the area. The ginger compounds do their work on top of that. 2 mechanisms. 1 simple routine. But here's what really caught researchers' attention. The third way is food. And this is the one I almost didn't include, because it sounds too ordinary to matter. Ginger tea. Every evening. 2 cups. Fresh ginger, slice it thin. Steep it in hot water for 10 minutes. Maybe add a little raw honey if you want. That's the whole thing. But here's why it matters more than people think. The NIH has reviewed ginger's systemic anti-inflammatory properties across multiple published studies. When you're applying it topically and consuming it regularly, you're addressing that synovial inflammation from 2 directions at once. Outside in, inside out. Remember that membrane I described at the beginning, the one producing all that excess pressure fluid? This is what targets it at the source. And since we're talking about food, a few others worth knowing. Fatty fish like salmon and sardines, rich in omega-3s, have some of the strongest research behind them for joint inflammation. Turmeric, specifically the curcumin in it, has been studied extensively alongside ginger. Tart cherries, surprisingly, have shown real results in clinical research for reducing joint soreness and morning stiffness. None of these are miracle cures. No food is. But evidence consistently points to them as meaningful support, especially when you're building a whole daily pattern around reducing inflammation rather than just reacting to pain after it flares. So let's bring it together. A warm ginger compress at night, a 5-minute oil massage, 2 cups of ginger tea, and a plate that includes more salmon, more turmeric, more tart cherries when you can. Not complicated, not expensive, not some protocol you need a specialist to supervise. Just consistent, small, real. The kind of simple that actually accumulates into something your body starts to feel over time. One thing before you go, if you're currently on blood thinners or any prescription anti-inflammatory, just have a quick word with your doctor before adding ginger regularly. It's a real interaction worth knowing about. Short conversation. Genuinely worth it. Next video. There's one thing most people eat at dinner almost every single night that researchers are now linking directly to increased joint inflammation while you sleep. It's not what you'd expect. Almost nobody suspects it. That one's coming up next. And if today's video gave you something useful, something real you can actually try tonight, subscribe. Because that's exactly what this channel is here for. Every week. No fluff. Just research that actually matters to how you feel every day. Thanks for watching.